Thank you very much indeed.
Thank you.
So we are now moving forward. It doesn't stop. Brian, it's a pleasure and an honor to have you join us. And so I wanted to introduce Brian. And Brian is the SBIR program manager with the National Institute on Disability, Independent Living, and Rehabilitation Research. The reason why we asked Brian in particular to join us is because we are increasingly receiving startup ventures that are dedicated to this particular space. And I thought it would be extremely valuable if we had Brian join us. He works expressly on startup initiatives, transformative innovations and technologies that is targeting on the population that includes all disability types and all age groups. This should be a very valuable presentation. So Brian, welcome very much indeed, and I'll hand the baton over to you, and it's all yours.
Thanks very much, Martin. I sent my email out in a chat because I'm having some internet issues apparently, so I wanted to make sure that if for some reason I get shut down, that everyone has my email address, and that is brian.bard@acl.hhs.gov. So if for some reason I get shut down, please send me emails. So yeah, I work for the Administration for Community Living, and under ACL is the National Institute on Disability, Independent Living, and Rehabilitation Research. And we are not part of the NIH, so that's an important distinction right there. And we do run our program differently. This brief history, I won't read it all to you, but we go back to something called the Rehabilitation, to the 1954 Amendment to the Vocational Rehabilitation Act. And over the years, we moved around and got called different things, and we ended up at the Department of Health and Human Services under ACL, which is a very good fit for us, actually. And this has been since the summer of 2014 under the Rehab Act. NIDILRR's SBIR program is unique in that its sole purpose is to increase the commercial application of research and development results and improve the return on investments. Mainly what I should say here is simply that our goal is simply to improve the lives of people with disabilities, and we are unique in that way. We are very small, and our SBIR budget is approximately $3.2 million per year, and we only hold one phase 1 competition each year at the very beginning of the year and one phase 2 competition sometime in the spring. I'm expecting our phase 1 to be released sometime in December. That's just an estimate at this point, and applications would then be due 60 days later. So that's for phase 1. And of course, as you know, phase 1 is to develop prototypes and models and proofs of concept. We are also different in that our phase 1 grants are smaller than most. It's $100,000 for 6 months, and we only make 10 awards per year. We usually get around 50 to 60 applications. Our phase 2 is, of course, like any phase 2, to further the research and bring it to commercialization, hopefully. Although that's not always expected on our relatively small budget, but only phase 1 grantees, of course, are invited to apply, but that includes phase 1 grantees throughout the federal government. Ours for people with disabilities. When I first joined, the Department of Energy, of course, is maybe a great place to apply, but so are we. So if your project has anything to do with people with disabilities, please consider NIDILRR. And our phase 2 awards are $575,000. That's a total for both years. We expect to put out $200,000 to $300,000 per year. The awards, of course, are for 2 years, and we make 4 to 5 awards per year. Lately, it's been 4, and we usually get a little bit less than 20 applications. And as I mentioned, we do invite phase 1 grantees throughout the federal government to apply. One thing that's different too is at the NIH, you all have a 40% acceptance for indirect costs. We don't have that authority. We can only, without an indirect cost rate agreement, that is. Unless you have an indirect cost rate agreement at NIDILRR, at ACL, you're limited to 10%. And that comes out of the grant. It does not get added to the top of it, unfortunately. These links, I'm happy to send this to anyone. It's to prior phase 1 and phase 2 awards. And there are links here that you'll see in the next slide that will help you to get to see some of these awards that we've made. And these are examples: low vision, navigation, readers, tactile devices. We used to fund mobile apps, but we now have a mobile app restriction because an inordinate amount of money was going into mobile apps, and we're simply limiting that now. We have developed an app factory where you can apply if you're interested in mobile apps, and we also at NIDILRR have other funding mechanisms that you can find on our website that are not SBIR, but that you would be eligible for most likely if you're developing a mobile app. So prosthetics, portable dialysis, switches for mobility impairments, learning software, all kinds of different things. And we are completely field initiated. So in any given year, no matter what you're thinking of, if it improves the lives of people with disabilities, you're welcome to apply. We don't have really, we're interested in things that improve the lives of people with disabilities. So we don't use specific topics other than that. So these links, if you are interested in these links, please send me an email and I'll send this out to everyone. And you know, you want to go to grants.gov and you know, you can search for NIDILRR, and this is, you know, it's the acronym for our agency's name, National Institute on Disability, Independent Living, and Rehabilitation Research. If you search for NIDILRR, you'll see our opportunities. We have opened up a few already, but not SBIR yet. And then, you know, we use Grant Solutions to maintain and amend grants. And if you don't already use Grant Solutions, then I suggest checking it out at grantsolutions.gov. And reporting is done through the link that you see here, nidilrr.rti.org. And the TA resources I have here are the life sciences that are on the SBIR website and the FAST program. And these other links are of interest. It talks about the SBIR program. It talks about, the next one talks about NIDILRR and gives you our mission. And the last one is NARIC.com, NARIC.com. And that speaks specifically to NIDILRR and the grants that we have made. And you can search SBIR phase 1, phase 2, and all of our other funding mechanisms to see the kinds of things that we funded. The abstracts are there, as well as contact information for the principal investigators, project directors, and project officers at NIDILRR ACL. This is a peer reviewer training module. And if you're not going to apply, then we ask you to donate your brain to science. And if you want to see what our peer reviewer training is like, here it is. And this gives you valuable insight into preparing an application for NIDILRR, whether you become a reviewer. And you know, again, our review process is very different from the NIH. So I do recommend, if you aren't ready to apply this year, that you become a reviewer and get the inside track for how to prepare an application. So this is the question slide. Does anyone have any questions? I wanted to save most of the time for questions, of course.
Brian, thank you very much indeed. That was very helpful. One of the initial questions that I had is that some agencies, and I think you may have tapped into Chris O'Gwyn's comments on a letter of intent, and also applicant assistant programs, phase 0. Does NIDILRR have any of those types of programs?
No, we're very small, and our budget is so small, we don't use administrative funds for anything. No, we don't have that. So we do have a technology transfer program at the University of Pittsburgh that helps successful grantees to commercialize. but that's it's not very large scale. But I always give the link to folks who are grantees.
Got it. Gabriel had a question, and I'm actually familiar with this project. He was asking whether a nurse surrogate robot innovation might be something that you folks might consider for funding.
So let me go somewhere here and show you something briefly. I still have my screen shared, I believe. Where did I put that? Hold on just a second. So this is our criteria here. And I bring this up because in a case like that, we score our criteria on a scale of 0 to 100 in SBIR and in most of our programs. And in SBIR, these are the specific criterion that we use. So I think that in this case, you would build your case using the importance of the problem criteria. And that is, you know, identifying the population, the target population, and you have to explain to the reviewers why that is people with disabilities, and clearly identify the problem in that target population. What is the population? What is the problem they're experiencing? And how do you solve it? That's in this criteria here for 20 points. And then I'm having an internet connection unstable warning. I think I'm going to turn my video off to.
Okay. Yeah, you are freezing up periodically, Brian.
Let's see if I can do that from this screen. So can you still see my screen, Martin?
Yes, yes, we can.
Okay.
Thanks, Brian.
That might help a bit. So you want to build your case and importance of the problem for a device like that. I think you could do that if you carefully identify the population as people with disabilities. As an example, someone was proposing something that would help to prevent pneumonia, upper respiratory infections on the general population. We would have not accepted that in our case because it was too much of a general population. And pneumonia may be serious and have some debilitating effects, but it's not considered a disability. The applicant geared this towards people with spinal cord injuries who are very susceptible to upper respiratory infections. And the way that she crafted that application, she scored very well and got funded by directing it at the needs of people with spinal cord injuries and the significant effect that upper respiratory infections have on the pulmonary system. So that was, you know, how she used this criteria to take her project and gear it towards people with disabilities. I could see that happening in a case like that.
Got it. There's another question based upon your answer, Brian, that I'm just reflecting upon a client of mine a couple of years ago from the University of Northern Michigan and Michigan State University, where they had a device to help individuals who had sustained a stroke and then were using that device to undergo rehabilitation. Without going into any further detail, that I think also might be a prospective fit to approach you on.
Sounds definitely like it's in our ballpark. Yeah.
Okay. And Arun had asked if you could provide your email address again. We can certainly do that, Arun, so no worries whatsoever. And good question from Jean. Glad you could make it, Jean. Hi. Jean, I think you were applying or were thinking of submitting an application relative to your seniors with Alzheimer's disease disorder. And I think you were thinking of the National Institute of Aging, if I remember correctly, probably wrong. But Brian, Jean's question was whether or not, yeah, thanks. He was wondering if whether your department might also be, your agency, that is to say, might be appropriate for seniors dealing with Alzheimer's. Dementia.
I would say so, yes. Now, when I look through the grants funded by the NIH, I see coincidentally a lot of benefit for people with disabilities, the elderly, people aging into disabilities, people who are aging with existing disabilities. And And that's great. All that work's being done. That is our specific goal. So we would certainly want to see an application like that.
Great, thanks. And Ely had a question, and this is an intriguing one as well, for folks who have disabilities. They're most likely at home, I guess, like the rest of us right now. But he was inquiring on whether a solution or an innovation relative to secure digital ID to help them be safe online. Is that a fit or is that a stretch for you?
So this sounds like something that benefits the general population.
Yeah.
And it's kind of like, you know, a light bulb is a great invention for everyone. Does it help people with disabilities? Yeah, sure. But is that the specific population of a light bulb? And it's not specific, but if you can identify a specific problem that people with disabilities experience and how this digital ID security feature benefits them specifically, I would say, you know, give it a shot. In a case like this, Gene, I think it would help if you were to send me a one-pager on what you're proposing so that I could run it by management and make sure that they're not going to shoot it down, because I have to get these approved. So I think it would be a great idea to do that.
It could be something not unlike, Gene, the specific aim statement that you've been working on for a while. So that might prospectively be helpful for Brian and his colleagues. Anonymous attendee had asked, and the answer is yes, share the criteria and links and possible PowerPoints and so forth. I think your slides are available for sharing, if I remember correctly, Brian.
I haven't sent those yet, Martin, but if you tell me the best person to send them to, I could send the slides and also the last year's funding opportunity announcement.
Oh, that'd be terrific. Yeah, two options. You can send them to me, and then both of my pugs will probably grab a hold of them and eat them. So maybe sending them to Misty might be a better idea.
All right, I'll do that right after this. Presentation's over.
Thanks very much indeed. And Milan Krupa, you've got somewhat complicated, so I'm going to try to paraphrase, if I may, Milan, and hopefully I do you right here. Milan was wondering if engine development available for wheelchairs and exoskeletons, interesting. Would that be a fit? He mentioned he's got a high efficiency fuel agnostic zero emissions engine. That's a mouthful technology. And can burn any fuel, produces no toxic emissions, helpful, no nitrogen oxide, and so forth. Anyway, ballpark, engines relative to wheelchairs and exoskeletons. What do you think? Is that possible for consideration?
So, I mean, if you're talking about a propulsion device for a wheelchair,
Yeah.
I don't know how you would make it work, but I'd love to see it. I've been begging the mechanics up the street to throw a two-cycle engine on my wheelchair because I wanted to see what that would be like. So, I mean, yeah, I mean, wheelchair propulsion is certainly in our wheelhouse, yeah. And what was the other one, Martin? Again, I'm sorry.
The question was had to do, well, the engine had to do with wheelchairs and exoskeletons.
Oh, okay.
And well, yeah, and by the way, that kind of ties into that Michigan State topic that I'd mentioned in a prior question. So yeah,
exoskeletons, we have funded things like that. We funded a project that was it was very narrowly focused on helping exoskeletons learn to sit down, which apparently is a challenge. Getting up out of the chair apparently is much easier than getting into it. So we funded a grant just for that. So exoskeletons, certainly, yeah.
Fascinating. Hannah, did you want to jump in and answer a question? I see a note that you wanted to answer a specific question live.
Oh, no, this is just my way of letting the participants know that this question was answered live. So I'm dismissing the questions as you read them.
Oh, okay. I was wondering why I was getting those messages all the time. All right. Connor, hi again. So you are involved in an ASL, and I lost your question. This thing's jumping all over the map here. There you go. All right. That uses smartphone camera and artificial intelligence to do real-time translation, called Sign. And it sounds like there may be other programs at NIDILRR, Brian, that would be better avenue than an SBIR.
It's possible because I think I mentioned our app restriction, our funding restriction on mobile apps. If I didn't, forgive me, but we do have a funding restriction on mobile apps. If the mobile app is the only thing that's proposed, now if it was a mobile app that coordinated with something else like a wheelchair sensor cushion, where the mobile app was a part of it but not the entire project. But this is one of those ones where if you're not sure if we would consider it a mobile app or not, to send me a one-pager would be helpful. And yes, we do have other funding mechanisms that would be, we have a lot of other funding mechanisms that many people on this call would be eligible for, and you definitely want to go to the ACL website and search for NIDILRR, or follow the link in the presentation that I'll send out at acl.gov, and you can see many of the programs that we, that's all we do. I mean, we don't have a lot of money, but all we do is fund research and development.
That's great. Thanks, Brian. I wanted to underscore a point that Brian has mentioned a couple times now, and that is send a single-page executive synopsis of your initiative for discussion. I can't underscore how important that is. And anyone who works with yours truly here, and Jean, Fernando, you know this only too well, that we set great store by and place great emphasis on single page specific aim statement or an executive synopsis in order to commence engagement in a more cogent and intelligent conversation with a program director such as Brian. So for everyone, it's a word that to the wise and that can help you, is that always prepare a single page executive synopsis of your transformative or expected to be transformative innovation. And then reach out to your program director of interest to hopefully commence with a conversation. It really expedites things and is very, very helpful if you do that. So recommended for everybody, a single page executive synopsis. Arian, Brian, wanted to see if you could speak a little bit more about the mobile app factory. And I think you indicated that there is limited funding for mobile apps, but maybe if you could speak a little bit more on the mobile app factory.
Will do. Well, you remind me of one other thing I want to mention first, Martin, and that is that you can apply for more than one project consecutively with NIDILRR. So you can give us 2, 3, or however many you care to write applications, as long as they're different ideas and they're not duplicative, of course. So we're not limited. I don't know how many NIH institutes might limit it to one fundable project, but you could get funding for more than one in the same year from us. So the app factory is limited funding, and I can send that link. It's I'm trying to think of the name of it right now. Sorry, but it slipped my mind.
Yeah. Okay.
The app factory link is it's a very guided process, and we have found that in phase 1 and phase 2, between the time that it takes to run the application process and the time that exists between the phase 1 and the phase 2 and the 2 years for phase 2, that 3 or 4 years can pass between the time a mobile app is proposed and actually hits the market. And in 4 years, mobile phone platforms change so frequently that we were finding apps were no longer going to work, and the shelf life was just too short for this kind of funding. So the app factory is very guided, and it's more like a contract in a way, although it's not really. By the way, we do grants, not contracts. The app factory is a really guided process where you get some startup money. It's not a lot. They're between $20,000 and $120,000 on average. It can be for more, but that's on a case-by-case basis. and you really work closely with the development team, and it's a, you know, step-by-step process, and they, you know, there's more input than you get from a phase 1, phase 2 grant or contract, and things, you know, can change along the way, which in a way they don't change in SBIR. And they, you know, there is a lot of consumer involvement, a lot of end user involvement, and you're constantly working with this panel to get your application, your mobile app, from one step to the next. And that input is useful because the success rate for mobile apps is relatively small. People don't want to spend a lot of money on mobile apps. It's not a big, mobile apps are not a, I mean, it's fine if you get $1.5 million from a government entity to develop it, but if you actually want to, you know, keep your head above water with a mobile app in the commercial world, it's difficult. So the app factory is designed to get around some of those hurdles, and I will, I guess I'll send that link to you as well. Unfortunately, they only accept applications once a year, and the deadline for applications was, I think it was September 15th, or it may have been September 1st. So they're not going to open that window again until next year. And we only fund SBIR phase 1 and phase 2 once a year as well. But it's fortuitous that we're getting ready to release, and we're having this conversation now. But the app factory, they just closed the window for applications. But I'll send it out anyway.
Thanks very much, Brian. And Thomas is asking a question, and I might answer it a certain way, but I'll toss it out to you anyway. Thomas is working on a clean tech project, and he is focusing on single-use plastics with same price substitutes made out of natural materials. I'm not entirely certain how that ties into NIDILRR, but I'll toss that out to you anyway to see if there is under any circumstances that NIDILRR considers clean tech projects.
Well, if this is something that's addresses a problem that people with disabilities experience, then perhaps it maybe they're just as an example, perhaps it involves a cleaner process for something that some people with disabilities experience, that like intermittent catheterization or bowel care or other unmentionables. But, you know, some of the things that can help them to do some of the things, you know, some of the personal care things, that's the only thing that I can come up with right now off the top of my head. But as always, it's up to the applicant to make the case to the reviewers what the problem is, how you're going to solve it, and then, of course, the project design and all those other things.
Sure. And anonymous attendee asks a question, Brian, do people who have a disability, and I believe what that means, people who have a disability who are applying for a grant, do they get any type of special consideration?
So if you look down in the, not really, although in the criteria, we do address project staff. It's worth 15 points. And the extent to which the applicant encourages applications for employment from persons who are members of groups that have been traditionally underrepresented based on race, color, national origin, gender, age, or disability. So, you know, I imagine you would score well here if you, the owner, have a disability. And then under adequacy and accessibility of resources, I assume that where you work is accessible to some degree if you have a disability. This last criteria may actually go away, and those points may go somewhere else, because in a phase 1, some say that it's a bit much to expect a small business to be accessible if they're only proposing a phase 1 project, and maybe the best idea in the world is going to come from someone's basement for a phase 1 prototype. Maybe a phase 2, it needs to be more accessible, but we may not have that particular criteria. But getting back to your question, I imagine that under project staff, you would score well.
Terrific. And I think I can probably answer Devin's question here, but I'll toss it out to you anyway. And Devin was indicating he doesn't have an exec summary yet, but there's no reason why he can't email an executive summary to you maybe a month down the road and still communicate with you.
Yeah,
Sure.
absolutely.
Yeah.
I love having conversations with people. I spend a good part of my day talking with applicants and prospective applicants about, how it works, and without giving anyone any help that's different. I provide as much general assistance as I can. But yeah, recruitment is a big part of my job, so I love talking to applicants.
And Brian, I wanted to ask a question. It's something that both Misty and I emphasize extensively. And for those of you who have submitted applications to the NIH or the National Science Foundation, other agencies, letters of endorsement and letters of commitment are very important. And I wondered, Brian, if you look for and encourage letters of endorsement or letters of commitment, and if so, is there a difference between the two?
So we call them letters of support, I guess. I think we call
Yeah.
them letters of support. And it's so a letter of support is important as long as you don't overwhelm the reviewers with 65 of them. But if you plan to work with an entity, whether it's recruiting subjects or using their facilities, certainly a letter of support from them is important. From potential vendors or commercialization partners, yes, it's very important. If you're going to be getting parts that are really specific to your project, parts or supplies. Maybe if you're doing exoskeletons, you need certain kinds of joints or motors. Then, a letter of support from the people who are going to supply that, those kinds of things. If you have a mentor of some sort in this project, then a letter of support from them. So, usually a good application has 10 to 20 letters of support, maybe a few less depending on the size of the project, maybe only 5 or 4 if it's a phase 1. But yeah, you don't want to go, because reviewers are going to be inundated, and it has to be organized. And when applying at NIDILRR, by the way, I recommend using this criteria as in this funding opportunity announcement, kind of as your table of contents almost. Because the reviewer is going to look for these, and if you organize them and kind of have a table of contents, it's that pretty much reflects this. It usually helps the reviewers to find the things in the application.
So that's really good to know. So if we just simply prepare our proposal in accordance with how you have outlined that, that probably would help a lot if we just simply categorized or created sections expressly to say importance of the problem, quality of the project design, those types of things, answer those questions. That's probably not a bad idea to follow those very closely.
And there are other things that you're going to put in. By the way, our application is we have a 50 page limit. So you have a double spaced. You have a lot of room to answer these questions. And there are some other things that you have to put in the application, like a budget summary that's not part of this 50 pages. In phase 2, a commercialization plan, which is part of these 50 pages. The letters of support and curriculum vitae or bios are not part of the 50 pages.
So that could be a problem for people like me who always have a philosophy. Well, gee, if I can explain something in 5 pages, it'd be better if I could do it in 50 pages. So that might be a problem for me. I'm saying that tongue in cheek, of course.
That raises an interesting point, though, Martin, and that is, so we don't use standing panels like the NIH does.
Yeah.
If your application is for an exoskeleton, you might be in the same group that proposes something that addresses sensory impairments. And so our reviewers we're going to have a couple of experts, or at least one in your field, but there might be experts there that are in unrelated fields. So maybe like robotics might be combined with the wheelchair engine that we were talking about.
Yep.
So you have to speak to the person on the street in your application, and perhaps that's why we allow extra space to explain things in a way that not everyone is going to I mean, people, they're all experts in the field of disability. We try to arrange the applications in like,
Hmm.
like one panel might be sensory impairments, but that might include vision and hearing. The other one might be mobility impairments, and that might be where you find the two that I mentioned earlier. So speak to the person on the street so that all five reviewers can understand what you're proposing, not just the lead reviewers who are experts in your particular application.
Got it. Thanks, Brian. And I wanted to toss out just a couple of quick questions, and then flip over to Fedi Suna's question. You had mentioned 3.2 million as your funding budget annually. Some agencies, as you know, offer matching funds if, say, at the completion of phase 2 or close to completion of phase 2 deliverables, they might get private equity funding. Does your agency in any way offer matching funds, anything like that?
No, well, we don't offer it or require it. And one other thing that brings up is that we don't do direct to phase 2. We don't do fast track. We don't do phase 2B or any of those things either.
And to confirm, you don't fund indirect costs.
No, we do, but it's part of the grant. So if you, for a phase 1, if you get $100,000 and you ask for 10%, then that leaves 90,000 to accomplish this project.
Okay.
We do pay the typical 7% profit fee on top of that. I'm sorry. So you can get, we do pay the typical 7% fee. So as an example, if you get a $100,000 grant and you ask for $10,000 of indirect costs and $6,000 in profit or fee, you're now left with $84,000 to run your project.
Mm-hmm.
So it comes out of the grant. We don't fund it on top of the grant.
Is the 7% part of that 100,000, or is that on top of it?
It is part of the grant, exclusive of the 7%. So you can take 7% of 93,000, I guess.
I see.
You can't apply the 7% to the 7% fee that you're taking, if that makes sense.
I see. Okay.
And that's throughout SBIR, I believe.
Got it. It probably improves our chances immensely if we ask for 6.9% rather than 7 for profit, huh? I say that tongue in cheek because there are people who actually ask that question. So anyway,
no, your indirect costs and your profit and fee are not discussed by the reviewers.
Okay, so enough of my bad jokes, but Fadi, I had a question here. What is considered a mobile app? So there appears to be a lot of interest in mobile apps today, which is fine. And his question is, are large enterprise software such as something to help clinicians internally in a hospital to help disabled patients, which may have a mobile component, would that be considered an app?
So it's hard for me to answer right now if we would, or promise right now that we would accept an application like that. But and so one tip for anyone who applies to NIDILRR, and I hope everyone here does, frankly, but we do use people first language at NIDILRR. So they referred, and if you do this, the reviewers will like it. We say people with disabilities. And not disabled people, and that's something that personally never bothered me, and I don't care about politically correct language when it comes to disabilities.
Sure.
But if you apply, remember to use that people first language. So a person with quadriplegia, not a quadriplegic, a person experiencing blindness, and that, I don't know, it gets a little carried away, I think, frankly, but. Political correctness is a very big part of the movement. So keep that in mind. And sometimes it might seem a stretch to use people first language, but do it when you can, when it's not. And now going back to the example that you gave. So it sounds like in many cases that in this case, I'm sorry, it sounds like the mobile app would be a component of a larger system. If that's the case, then it would probably be accepted. But if you're just developing a mobile app that teaches someone, I hate to pick any particular kind of disability, but if you're developing a mobile app so that wheelchair users can like a dating app for mobile for people of mobility impairments, that where all you're doing is looking for people like you out there to socialize with, I guess kind of reinventing Facebook maybe. That would not be, that's all mobile app, and that would not fly. But if the mobile device is just a way to tap into the larger system, then it probably would work. And one example I would give that may not always be easy to translate, but let's say you're developing a wheelchair cushion that helps people to detect excessive pressure so that they can do pressure reliefs in their wheelchair. And if the mobile app is the way that they receive the notifications that they need to do a pressure relief, then certainly that mobile app, because it's connected to the wheelchair cushion as a device, would be accepted. Does that apply to the case that you just gave me? Maybe. And you would certainly want to send me that one pager we keep talking about so that I could get an initial thumbs up for it before you go through all the trouble of applying, because it is in the gray area that we'd have to think about.
Great, thanks, Brian. And Jean had a question. I don't know, Jean, whether your question was pertaining expressly to NIDILRR or whether it was across the board to all agencies. But Jean wanted to know, Brian, whether universities can be used as a subcontractor in SBIR applications. And if so, I think, Jean, you're responding to overall SBIR phase 1, phase 2, where there are percentage specifications and so forth in terms of how much of the time and resources should be allocated to the small business concern. But with Brian, in the case of NIDILRR, can universities be used as a subcontractor? And are there any specific allocation of percentage funds and so forth, say to the SB's small business concern versus subcontractors?
No, we, as much as possible, we follow all the guidelines in the policy directive as far as those percentages go. So that the 50% for a phase 1 and or what, I forgot what the percentages are right now, but we follow those exactly as the policy directive advises. And certainly a university could be one of those subcontractors, yes.
Sure, absolutely. So this is just an overall question, Brian. You have seen and reviewed more applications than you'd probably care to confess to. And so based upon that, are there any areas that you see repeatedly that appear to be the greatest challenge or maybe stumbling blocks for us that maybe we should be a little bit more aware of or pay more attention to?
So not addressing the population correctly is a big one for us. And it's a very difficult position for anyone where I work to try to describe what a disability is. And it's an argument that I almost always lose when I try to describe what a disability is. But like I use pneumonia as an example of something that is, or a broken arm that's not a disability. But identifying the population correctly is a really nuanced thing, because you can say, you can define an application that's very broad, and reviewers will say, oh, there's no way that all 52 million people in the country who say they have a disability are going to buy this just because it affects people with disabilities. But on the other hand, if you're proposing something that has a very limited commercial market, then they might say that your population is just too small to be a commercial success. So finding the right balance between too much or too broad and too little or too narrow is a real challenge. Defining the importance of the problem, includes the population. So, the population and the importance of the problem that they're experiencing are very challenging. And, citing the proper amount of literature is another thing. You can't just say things just because you think they are true. You have to cite where that comes from. So citing literature is important. And also another one is citing the state of the science, what's already out there. And did you cover it properly? And why is your proposal better and going to improve the state of affairs over what's out there? And don't miss things that may be better than yours. Make sure that you talk about them all.
Got it. And another question that I had, I picked it up from other presentations as well. There are some agencies that have, I think they're called phase 0, or maybe applicant assistant programs or something like that. Do you and NIDILRR have anything like a phase 0, the Dawn Breaker type programs that other agencies use?
No, I guess that I'm kind of the phase 0. I mean, I just
you are the phase 0, yeah. Okay. Well, Brian and Misty, I have tapped out of questions. Misty or Hannah, do you see other questions that are on Q&A that I have for some reason missed that maybe we should take a peek at before we let Brian go and get on with his life or engage in other one-on-one? No open questions, so I guess we're golden. Now's your last chance, everybody. We have a few more minutes, and Brian is wide open. He's happy to stay here with us. Going once, going twice. We have a very shy audience here, Brian. They're really mostly introverted people.
Oh, that's all right.
Yeah, they're not party animals. Let's just put it that way. So
I look forward to questions after this.
Yeah.
If anyone would like to one-on-one.
Yeah, almost invariably when well, here's one. What are you? Okay, Suzanne threw in a question that maybe we can tackle. Not entirely certain what the question pertains to, Susanna. So, in fact, what the heck? I've been reading all the questions. Hannah, if we can open up Susanna for her to ask her own question. I'm not entirely, her question, Brian, is what are greatest needs? Don't know whether that is our greatest needs as a society. What are your greatest needs? Or maybe Susanna, if we can open you up, perhaps you can ask your question on your own if you wish. Can we do that, or is that not doable, Hannah?
While you're working on that, if
hi, can you hear me?
Oh, hi, there we go. Yes,
hi, Susanna. Yeah.
Hi, my name is Susanna Choi, and my question is, what do you see the greatest needs of funding for? What are the biggest challenges that you need help with?
So NIDILRR does have a mandate to address the people with the most significant disabilities. Now, that's another thing that's open to interpretation, because it's hard to tell someone that their disability is not significant, and that's an argument that you will probably lose. But nonetheless, what constitutes a significant disability is probably up to you to make that case to the reviewers. But in my mind, it's cognitive disabilities are very significant, and it's very difficult for people with cognitive impairments to overcome the information processing. And a good example of that, for instance, may be employment. So can they even understand a website and put in a job application? So cognitive impairments are certainly very, very significant disabilities that must, in most people's mind, rise to the top of what is significant. And severe mobility impairments are another one. If someone can't get out of bed, not a whole lot else in life matters. So those are two examples of significant disabilities that if you have a product that helps to address that, then that's great. The things that we're interested in, are transportation, employment, community living in general, of course, but transportation and employment are things that help to really equalize the world for people with disabilities. And there's just so many things connected to that. Susanna, that it's hard for me to pick something in particular.
That was tremendous. That really helped. Thank you.
Thank you, Susanna. Brian, you had indicated that you're not exactly like the NIH, or you're actually not even a part of the NIH, if I understand you correctly, or maybe to some extent. But can you share, is there a generally understood or expected timeline from the time that we submit a proposal to you and when we may hear back, and if it's favorable, when funding might be available?
That's a great question. Thanks, Martin. I should have included that. So the applications for phase 1 are due, of course, on, well, I don't know when they're due. I'm sorry. We're expecting them to come out in the middle of December. Let's pick December 15.
Mhm.
So that means that they would be due on or about February 15. And last year, the funds weren't made available to the winning applicants until September 30th. Now,
Oh, my.
yeah, so, and, you know, there was a GAO, and the GAO looked into, not us in particular, but they looked into it in general. And we, although we didn't get a particular recommendation, we did move it up to September 1st this year. And we may be able to make them even sooner this coming year. It's a real challenge for us because we're so small, and,
Yep.
and you know, we're part of an organization that has to look everything over, and we don't have complete autonomy in this area, so we do have to work in a system, but we are trying to make it happen sooner. Now, phase 2 would then come out, you know, let's just pick April 15, and then they would be due June 15, and then, you know, those would also start at the same time. Phase 2s would start, you know, September 1st again this year. So we're trying to squish that timeline down, and it's just a challenge for us because we have a small staff, and we are, again, I already gave my excuses, I'm sorry, but we are trying to squish that timeline.
Terrific. Well, Brian, we've done it again. We've exhausted an hour, or pretty close to it, and we are immensely grateful for the time that you've given us.
Oh, thanks. This is a pleasure. I really enjoy doing this. I do want to mention that for phase 2 applications, we accept phase 1 grantees from the prior 3 years. We go to 3 years on that. And
Okay.
we don't have a limit to the number of times you can apply for a phase 1. You can apply over and over again with the same idea. And I already mentioned you can receive funding for more than phase 1 or more than one phase 2 at the same time from us if they are different ideas.
Okay. And you're certainly aware of the applicants who have submitted prior proposals and so forth. So you're familiar with the sequence when they continue to resubmit.
For phase 1s, yes, but again, we don't restrict it because we're for us, it's all about capacity building. We want to see a second and even a third application where our reviewers try to help people to build better applications in a very constructive manner. And phase 2, we do have that limit because technology can get stale.
Brian, this is terrific, and I'm so delighted that you gave us your valuable time, and I was especially interested in you joining us today because this is an area where this topic is receiving an increasing amount of interest all the time. Misty and I are receiving growing interest in this space, and we very much look forward to